All right, so welcome to our next lecture on first aid. And, obviously this is not a fun topic, but I'll try to keep the energy up a little bit. And before we get started on first aid, I just want to say, if you have any doubt with any injury, any illness, do not hesitate to call a veterinarian or an animal health specialist and ask for advice, because you don't want to be doing something that's going to either worsen the injury for your animal and cost you more money in the long run with treatment, and you want to make sure you're doing the right thing with that. So most large animal veterinarians will offer advice over the phone freely, or develop that relationship with them that you're able to call them and say, hey, this is not looking right today, what do you think? And they'll give you the advice, because they're the ones that you always want to look to. So with that in mind, I'm going to show you some situations where you absolutely should call the veterinarian and have them come out and treat the animal. And then some situations where, you can treat it on your own because it's really not that big of a deal. So we'll talk through that. Now, again, with review, abnormal behavior, that's all I can really, tell you as far as how do you know if something's wrong with your animal. You have to be able to detect that. And that's what makes these animal health specialists or veterinarians so amazing, that in a human, again, like we talked about in the last lecture, you're sick, you don't feel well, your leg's broken, something, you can say, hey, help, and you can communicate to your physician or to the ER folks or to the ambulance or whoever. A horse can't do that. A donkey can't do that. They tend to hide pain because in their nature, out in the wild, if a horse gets injured, they can't scream and bellow and yell, because that's going to attract predators. So they tend to suffer in silence. I mean, they really do, and they tend to hide it, because if they're the ones that's sick or injured, that's who the predator is going to pick off, because they're easier to get at. So that's why veterinarians are just so amazing with what they can do. And as you're around these animals enough, you start to detect differences with them. So, all right, so in an emergency situation, the best thing to do is to have a plan. In your mind, realize at some point these animals are going to get hurt. We all have. We've all gotten hurt in our lives at some point, whether it's a minor scrape, unfortunately broken bones, something not so fun, to really serious injuries. And again, these horses and donkeys and mules, they're going to run into something too. They're going to get hurt. It's just the nature of the beast, and that they're outside all the time, typically puts them a little bit more at risk of getting hurt. So you have to kind of plan to deal with that. And some of the things you want to do is make sure you have your health professional's telephone number nearby, or for anybody that's taking care of your animals, make sure it's accessible, like in the feed room or where you keep your tack, or on the fence, anything in case of emergency. Call who, have some backups. And plan for different injuries, so the minor ones, the major ones, and then things that people don't think about. The immobile injuries are the ones that are really tough to deal with, because say they're way out in the pasture. How are you going to get that animal up to the barn to treat them if they can't move? What are you going to do? Well, I'll go take my truck and trailer back there. Can it get through the fence? I mean, can you get back there? Is the ground going to handle it? So those are things in your head that you should probably think about. Now, at the end of that last slide, I said to have a first aid kit. And here's just some of the things that you could put in a equine first aid kit. And this isn't a complete list. Really, if you go online and kind of search for, horse first aid kit, there's other things that can be on there. These are just some of the things I felt were important, to help, mobilize the animal or handle the animal with a halter and a twitch. And you want to make sure you have clean bandaging and buckets and materials. Snake bite kit, something, a lot of us don't think about. Should we have that on hand? Well, yeah, especially if you're doing like trail riding through areas that have lots of snakes. I mean, snakes are everywhere pretty much in the world. Wounds, stuff like that. Even a flashlight. Didn't even think about a flashlight, because what if it's late at night and you need to see? So those are some things that you should have in there. Now, the number one rule when dealing with an emergency is for you to stay calm. Because if you go out there, and some of these injuries can be really, really horrific. And also, I will say this, horses can bleed a heck of a lot of blood and be okay. It's just we see the amount of blood and we really freak out. And I've seen it before too. And I've been like, oh my goodness, get really nervous. And you don't want to do that, because if you get really nervous and you're like, oh, my God, what am I going to do? That animal is going to feel that. And that animal is going to get nervous too, may shy away from you, may bolt from you, and they can either, make themselves, injure themselves even further, or, you're not going to be able to treat them. So you want to be calm. If you're calm, the animal's calm. So always please remember that. And also make sure you're going to be safe, your own safety, because if you get hurt, you can't help your animal. And, as the owner, you need to put your health ahead of your animal. So be very careful, because some of these injuries can really, scare the animal. But generally horses, I think, I've been around them enough that if they realize you're trying to help them, they're generally can stay calm. Now, also you want to monitor the environment, the weather, if there's a snake bite, like your horse just got bit by a snake, make sure the snake's not around before you jump off the animal, or stuff like that. But things like, here in the United States, we get tornadoes. Here in Florida, we get hurricanes. So I'm not going to go, take care or try to treat an animal in a hurricane if I don't have to, because, again, I'm putting myself at risk, and I'm not going to be any good to my animal if I'm dead. So, monitor those situations and make sure it's safe for you. And then you want to assess your animal. So is it safe for them to approach, and then can you move them? Because if you can move them, you want to take them somewhere where it's quiet, where they can be calm and they're kind of confined, so they can't worsen their injury or get away from you easier. So you want to do that, and then check the vital signs, which we just had that lecture on, and kind of assess your animal. Now, I'm going to go through some emergencies, and you're going to notice at the top of most of these, contact your veterinarian or health professional immediately. Okay, so these are injuries that obviously you're not going to be able to handle yourself. So you're going to need some medical attention. And the first one is, obviously a fracture. And you want to immobilize the animal if you can. And also you can build a splint. So here somebody was pretty intelligent. And they just got a big board here, and there's probably a board on the other side of the leg. And they just wrapped it with what we call duct tape, and just wrapped it to immobilize that wound. So if you can, splint the leg, there's things you can get, like a pipe, and cut the pipe in half, and build that around, and make sure there's some padding in there so you're not rubbing against the skin of the animal. But you want to try to immobilize that wound until you can get them to a veterinarian. Now, the next type of emergency that you want your veterinarian to come out and treat is a puncture wound. Because puncture wounds, can be especially dangerous for these animals, and they can tend to get infected. So you want to make sure that they're properly treated, and because they can be really, really deep, you can't just artificially put a bandage out there and some little disinfectant cream and hope they heal. They really need to be seen by a doctor. So if the object that's in there, in the puncture, if it's still in there, if it's shallow, you could, like a splinter or something, you can pull it out and be okay. If it's deep, I would leave it in there until the veterinarian gets there to do that. But if they are bleeding, and again, these animals can bleed quite a bit, you want to hold pressure to slow down or stop that bleeding. And then you can clean that wound with some antiseptic if you want, and then cover the wound and then bandage it until they receive treatment, if you think you need to do that. Now, one of the most important things with puncture wounds is you want to make sure your animal is vaccinated against tetanus. And in the disease lecture, we'll talk more about tetanus, but especially if they did get a puncture wound, you want to make sure they're up to date, because tetanus is a horrific disease that you don't ever want to see. Okay, and the next kind of wound that you definitely want to be seen by a veterinarian is an eye wound. And that's because this can lead to blindness or even loss of that eye. So you want to make sure they are seeing that their eye can be taken care of. Now, if you do have an eye injury, you want to move that animal into the shade, so they're not in the bright sunlight. And then you could put this thing, these are fly masks, which you can get and put on. And if you don't have access to that, you can put some fly spray or ointment around the wound. If you are using fly spray, again, be very careful not to try to spray that in the wound, because it could hurt and irritate that wound. So you want to do that. But you basically just want to keep flies away from there, because they will gravitate to wounds to feed and lay eggs and stuff like that. All right, now most lacerations, that's probably a typical injury. They're going to scrape by a fence or a post, or, one of their other buddies bit them, like, oh, I'm not liking you today, and they'll reach out and nip them. I mean, lacerations are pretty common. These ones that get near the tendons and joints, you definitely want a veterinarian to come out and treat them. And again, for any superficial wounds or these lacerations, these are pretty common steps. You want to put a pressure on the wound to slow the healing. You can hold the bandage or gauze on the wound. Then you want to wrap it in cotton to put some protecting that wound and holding that bandage in place, and then put adhesive tape around, and that will hold that bandage in place. But you want to make sure it's not so tight that you're restricting blood flow. So those are pretty simple steps to treating a wound. But again, this type, you want a veterinarian to come out to make sure there's no ligament or tendon long-term damage to the animal that could reduce their use. I mean, if they hurt those lower limbs like that, you may not be able to ride them again. So you want to make sure that the veterinarian looks at them. So some other emergencies that we're not going to have time to cover, but any type of respiratory distress, you definitely want the animal to be seen by a health specialist. Any lameness, especially lameness that they can't move, high fever. Again, we've talked about colic enough. Dystocia, which we'll cover a little bit more next week, but if you're having difficult foaling, obviously you want to get a veterinarian out there immediately. You definitely want them to be seen for a snake bite, and I put this at the end, again, when I started this whole first aid thing, any type of situation you really feel overwhelmed, or you know what, I need a doctor's advice, do not hesitate to contact them. Please do not, for the health of the animal, and also, protecting your pocketbook in the long term, that they don't get worse, and then you actually could lose your animal or cost you more. So now, some of the ones that you can treat yourself, I call them the bumps and bruises. These are things that typical wear and tear on the animal. So if there are, they can get bruises by kicking or running into things. Saddle sores, which you can see here, it's a little bit nastier, but again, it's a wound because you have a really poor fitting saddle. So it rubs, and then they get these injuries. You can just put cold packs on these, and you can just put cold water on there to reduce the swelling, and then of course rest, to allow those wounds to heal. Minor lacerations, again, we've talked about that. Control the bleeding, clean the area with a disinfectant. You can apply an ointment, either a Vaseline, which some people don't like, but some people recommend, or a nitrofurazone-based ointment, and try to keep the flies away. That's what some of that stuff's doing. And then watch for infection, and again, rest. All right, and then we're going to finish out this lecture with just some first aid don'ts, things that you shouldn't do, and I think these are easier to remember for you. So you don't want to apply any astringent or caustic like iodine on any wound deeper than a superficial scratch or abrasion. I mean, it could be really, really painful for the horse if you did. And then these two, no medicine to any wound that's going to be sutured, obviously, unless the veterinarian tells you. Anything the vet tells you, do, because they, went to medical school, they've seen it, they're out in the trenches, healing these animals. You don't want to apply any salves to any open, deep wounds. Just those superficial ones is where you want to use those. And you don't want to frequently flush a wound with cold water. Now, we do tell you can clean water or use clean water to clean wounds, but if frequently flushing here can develop something that's called proud flesh, and it's really, really nasty, and it's this granulization of the tissue as it grows back. So it's like our scars, but they're just gross. And you actually have to get those like surgically removed or burned off to reduce that flesh that's there. So you don't want to every day flush out that wound with cold water, because that actually helps promote proud flesh. Now, things we've already talked about is don't wrap any wounds or legs without padding. You want to make sure there's padding in there, because again, that's helping to not restrict the blood flow, because there still needs to be blood flowing to those limbs. And don't leave a bandage on for more than 24 hours, and you want to, let some of that circulation come back and then reapply a new bandage. And then anytime you're flushing out the eyes, make sure there's no salt water in there or any type of sugar. So you definitely don't want to do that. So here's your list of don'ts, things you shouldn't do. with an injured horse or when you're looking at first aid. So that's kind of a quick overview of first aid. Again, there's many online resources, and your local health professional is the one person you need to turn to the most for any questions you have related to your animal's health or dealing in a first aid situation. All right, so in our next lecture, we're going to start jumping into the nasty, creepy bugs, the parasites. But again, they're very important to understand and how we treat and eliminate these guys from the animal's body. So just to leave you again with first aid, final thoughts. When in doubt, pick up the phone or walk, wherever you are in the world, find out who your animal health professional is, turn to them and ask them for advice, get to know them. They're going to be the best sources of information that you will get on how to maintain your animal's health and when to deal with any emergency or first aid situations. So I'll see you next. We're going to be talking about bugs, yay. I'll see you soon.